Now it's time to imagine better health with CHI Health. Losing weight isn't just about being a smaller size. For many people, it's a matter of better health.
That includes diabetes and heart disease, but try as you might, you may not be able to lose the weight on your own. It may be time to look at other options.
That's right. And Dr. Pradeep Baladi is a bariatric surgeon with CHI Health. Good morning, doctor.
Nice
Good to see
you
you this
here.
morning.
Good morning, guys.
Typically, who opts for bariatric surgery?
Typically, it's a 40-year-old, 40 to 50-year-old Caucasian female who, after pregnancy, has gained weight and has not been able to lose weight, and is interested in getting back to their good health and be able to play with their kids, do other activities that they wanted to do. And that's what the typical patient who comes to us for bariatric surgery is.
Sure.
Which factors do you look at if you determine that someone is a candidate? Are there certain things that must be there?
Yes. If the patient is at least 100 pounds over their ideal body weight, also if the body mass index, which is a calculation based on the height and weight, if it's more than 40 by itself, or if you have more than 35 and other conditions such as diabetes or hypertension or coronary artery disease, which are risk factors that are related to the obesity. If you have those, you're a candidate for bariatric surgery.
Yeah. And from what I understand, there are two types of bariatric surgery, right? What are they?
The bariatric surgery itself is a surgery of the stomach where we decrease the size of the stomach and decrease the amount of food that you take. The two most common that are done are the gastric sleeve and the gastric bypass. Gastric bypass has been here. Gastric sleeve is the one which has been done more recently. It's been done in the last 10 years or so, where you take out about 80 to 90% of the stomach, as you can see in the picture there, and make it a banana-like tube that is left over. And that's the part that makes you, that you can eat. You can only eat up to 3 to 4 ounces of food at a time. And so you eat less. And also because you don't have that big stomach, you don't feel hunger also.
So that portion of the stomach that we're looking at right now on the right is totally removed, right?
Yes.
Yeah. And
Or
then
not accessible. But then you said there was a second common form, and then I want to get to what's brand new that the FDA has approved. I know you're excited about it. But what was the other form that we might have heard about before?
The gastric bypass. That is what most people used to think about the weight loss surgery is. Bypass is also short name for that. Here we make a small pouch of the stomach about close to the esophagus, and then we route a piece of the small ball from down and attach it to it. So what are the food that comes in goes directly into the small ball and does not go through the rest of the stomach or the other part of the small ball where it's not digested. So you are eating less because of the small pouch, but also you're not digesting enough because you're losing, all the food is bypassing it. That's why the word bypass. Due to the way it is bypassed, we know that people who are diabetics for less than 5 years, immediately get the diabetes resolved immediately with this bypass surgery.
That's huge. You're saying the diabetes, and that's for a lot of people, as Mike said, being a smaller size is one thing, but when you can change your whole health picture, that's a different story altogether.
Yes. Diabetes is the most leading cause of is the second epidemic along with obesity now. We are seeing more and more people who have diabetes, and there are many drugs you can control the diabetes, but bariatric surgery is the one which you can actually completely resolve the diabetes. You're off the medications, especially the bypass has a higher instance of relapse with diabetes compared to the sleeve. That's why if you're a diabetic, we recommend having the bypass. Both are very good operations. Both are operations we do it laparoscopically with small keyholes. You come in the morning, get the surgery done. You're in the hospital for 2 to 3 days, usually 2 weeks of recovery. You need to be on a special diet before surgery and up to 2 weeks after the surgery, but usually people are back to work around 2 weeks after surgery. And they see a tremendous weight loss in the first few months.
yeah, and that's the advantage of the laparoscopic surgery for both of those procedures. Excuse me. Then you have the third procedure, the new one, that's still the FDA just finally took a look at. Explain what it is.
So the intragastric balloon is where we put a piece of a balloon. It's a grapefruit-sized balloon that we put it in the stomach. It's an endoscopic procedure. You come in the morning, in light sedation, we put a piece of the balloon inside your stomach. It takes up around half the portion of your stomach routinely that you can eat. It gives a sense of fullness because of the balloon being there all the time, so your hunger is less, you get to lose weight. Balloon is taken out again in 6 months duration. Average weight loss is around 10% of your body weight on average for 6 months. After 6 months, we have to take it out. Again, it's a small procedure, endoscopic procedure. You come in and get it done. people lose around, as I said, 10% of their body weight, and it's also along with a program where you need to be on a diet, you need to be on an exercise regimen, and after 1 year, we've seen that the weight you lost, you keep it off too. We don't know, this has just been approved, it just came out last month. There are 2 balloons that have been approved right now, and we don't know if it will, what the long-term outcomes are. Even though the FDA gave the approval, the insurance have not come up yet, so it's mostly self-pay right now.
What type of patients would be good candidates for that procedure?
Yeah, this is actually on the lower side. The BMI between 30 to 40 it has shown the best effect. It is not for everyone, but for a motivated patient, it will work very well. We are also using this on a non-FDA approval basis. We are using for people who are very, very, very obese, trying to get them to lose some weight going on and getting them towards weight loss surgery.
I've read that people think seriously about bariatric surgery for 5 years before they finally decide to do it.
Oh, yeah.
And so they offer these free seminars, and you do this every month,
Yes.
right? So the patients can come in and really start to understand what are my options and what would be best for me. So that's the second Wednesday of every month from 6 to 7 o'clock, CHI Health Emmanuel on North 72nd Street. You will need to call to sign up, but if this is something where you have thought about it, even if it's just a few months, or if you're closer to that 5-year mark, call 572-3684 and let them know you'd like to take advantage of one of the free seminars.
Yeah, and like she says, patients think for 5 years before getting these procedures. With this new procedure coming out that the FDA just approved, people will be learning more, and that's you can provide that information to patients as well.
Yes.
Online at chihealth.com/bariatric-surgery-program. Dr. Pilati, thank you for joining us.
Thanks, doctor.
Thank you very
Good to see
much.
It's been a
Good information.
pleasure.
Good to talk to you.